Get injuries to the hip. They don't get a lot of attention, but as Tim Doty found out when he visited Spectrum Health Medical Group, they are a problem that's becoming more and more common.
The hip joint is essentially covered in muscles, the muscle attachments.
Dr. Olusanjo Adeoye knows the hip well, but the Spectrum Health Medical Group orthopedic surgeon is seeing a lot of people who don't know the limitations of their own body, often pushing it too far, too often.
The difference between being active and being in general good health, and then taking it to the nth level, so to speak, as far as competition. And I think we need to strike that balance.
While there are breaks and dislocations from a collision, the majority of the issues that the doctor sees are from overuse, a topic we covered last week in the Medical Moment.
Especially with the, again, with the single sport athletes, we're seeing more and more pediatric patients, so teenagers and young adults who are college athletes.
In a sport that requires a lot of hip rotation, impingement can occur.
What happens is that your hips develop a certain way, and and certain hip shapes are at higher risk of having this, hip issues. Right underneath this area where the growth plate used to be, we often see either a bony bump in this area, and as you flex the hip, that collides, and this is the area where the labrum is. And with repetitive collision, the labrum gets injured and torn.
Dr. Adeoye says genetics do play a part, but it's too soon to connect the dots and preemptively tell a kid he can't play a certain sport because of family history. But a little knowledge of what can happen in the future can help an athlete make better choices right now.
It is not unusual for me to see, a patient's father go, "Oh yeah, I've had this, I had the similar symptoms when I played football 30 years ago. We just ignored it, and I needed to have my hip replaced, when I was in my late 40s."
Tim Doty, Fox 17 News.
Nice and mild out there today, but that's not going to stick around the rest of the week.
Yeah, we'll have it for a couple of more days.